Ever wondered what comes after the operation for a perianal fistula? What does post-operative management entail? Today, we're taking a closer look at this very topic. Peri-anal fistula, a chronic infection that forms a tunnel-like channel from the anus to the skin, is often a result of a prior anal infection or abscess. Surgical treatment is a common way to address this condition. However, the journey doesn't end with the surgery. Post-operative management is crucial for a smooth recovery and can involve several important steps, from managing pain to scheduling follow-up appointments. So, shall we dive into the step-by-step management of peri-anal fistula post-surgery? Buckle up, because there's a lot to cover. Right after the surgery, there are a few key things to take note of. You might experience certain symptoms like pain, constipation, difficulty in urinating, and rectal bleeding. This can seem alarming, but it's important to know that some level of discomfort is expected and normal. The pain is your body's way of reacting to the procedure, and constipation might occur due to the medications prescribed. Difficulty urinating isn't uncommon either. It's generally linked to the discomfort and can be managed with warm sitz baths that help relax the urinary sphincter. Bleeding from the rectum is also a potential symptom. However, it's crucial to distinguish between normal and abnormal bleeding. A bit of bleeding is normal, but if you notice it's prolonged or profuse, it's imperative you report this to your doctor right away. Remember, your body is in a healing phase, and these symptoms are part of the process. But always keep your healthcare provider in the loop about your recovery progression. That covers the immediate post-operative phase, but what about the days following the surgery? Pain and urination difficulty can be quite common after the surgery. But fear not, there are ways to manage these symptoms. One of the most effective methods is through prescribed pain medication. It's crucial to take this medication as directed and not to exceed the recommended dose. While this medication can alleviate your discomfort, it's important to be aware of potential side effects, which may include drowsiness, dizziness, nausea, and vomiting. As such, it's advised not to drive or operate machinery while taking the medication. Another useful method of managing these symptoms is through warm sitz baths. These can help to relax the urinary sphincter, making urination less painful and more manageable. It's a simple yet effective method that can be done in the comfort of your own home. While these steps can help manage pain and urination difficulty, it's crucial to maintain a healthy diet to prevent constipation. A healthy diet and regular follow-ups with your doctor are crucial for a smooth recovery. After a fistulotomy, it's vital to prevent constipation. This is where a high-fiber diet comes into play. Incorporating foods rich in fiber, such as whole grains, fruits, and vegetables, can help maintain regular bowel movements and reduce strain on the anal region. Drinking plenty of fluids is equally important as it helps soften the stools. It's recommended to limit caffeine and alcohol consumption as these can lead to dehydration, exacerbating constipation. Now let's talk about follow-up appointments. These are typically scheduled 3 weeks post-surgery. Why, you ask? Well, these appointments allow your doctor to assess your recovery progress, address any concerns you may have, and guide you through the next steps of your recovery journey. It's essential to remember that every patient's recovery process is unique. So, be sure to pay attention to your body's signals and report any unusual symptoms to your doctor promptly. Remember, adhering to these steps is key to a smooth recovery. But we're not done just yet. Let's quickly recap everything we've discussed today. Dealing with the aftermath of peri-anal fistula surgery can seem daunting, but with the right information and understanding, it becomes a manageable task. Immediately after surgery, you might experience pain, constipation, difficulty urinating, and rectal bleeding. It's important to remember that some bleeding is normal, but if it's prolonged or excessive, it's time to notify your doctor. Managing pain and difficulty in urination is also crucial in the post-operative phase. Painkillers will be prescribed, but it's vital to adhere to the instructions and not exceed the recommended dosage. Warm sitz baths can also be beneficial, helping to relax the urinary sphincter and alleviate discomfort. Diet plays a significant role in recovery. Eating a balanced, nutritious diet can help speed up the healing process and prevent constipation. Regular follow-up appointments are also necessary. These are typically scheduled 3 weeks post-surgery, providing an opportunity for your doctor to assess your recovery and address any concerns. And that wraps up our discussion on the post-operative management of peri-anal fistula. Make sure to hit subscribe and ring the bell for more informative videos like this one. Remember, your health is in your hands, and knowledge is the first step to taking control. See you in the next video.